Hello, my name is Rosa, and I'm going to talk to you about the political and the legal changes in the healthcare industry. We're going to look at it from a global standpoint, and what I found unique about the global standpoint was that poverty and inequality had a dramatic impact on a person's ability to receive health care that would be of quality. You got 1 billion people that lack access to the health care systems. Approximately 17.5 million people died from cardiovascular diseases. Health and poverty and inequality, many of the diseases are diseases of poverty. As I stated earlier, the poorest of the poor around the world receive, just like in the national and local scene, the worst health coverage. You looked at also structural adjustment, cutting back on vital health and educational services in third world countries because of the fact that they can't afford it. They have to, their economies are restructured to ensure that they repay back the debt to the rich countries. On the national scene, we looked at coping with the cost of health care. The challenge is a disagreement about what reforms should take place. I'm sure you listened to the national news and seen some of the emotions about the Democratic and Republican bill. The Democratic bill was proposed by President Obama, and House Republican proposal bill started with John McCain during the time that he was running for the presidential election. The government run plan focused on a public plan, a public option, and that's really an emotional issue for people that oppose it. It covers the children and uninsured adults, and the cost would be about $1.6 trillion over 10 years. Many people are concerned about the cost of the bill. The government run plan for the Republicans has no public plan, but they cover the affordable and accessible to all. They look for it to be affordable and accessible to all. Costs are unknown at this time. And they're also looking at funding it by reducing the Medicaid and Medicare. On the local scene, those issues that I just mentioned are the focus of central focus of the town hall meetings they're having. Some Americans dislike that public option, or they feel like it's just too high a cost. So they use these town hall meetings to get their miscommunication information corrected and for the people to have a voice. There are debates on both sides. There are talk of death panels, and as I said, the public health option and the cost of the reform would be the three major areas that people are having concerns about. On the technological changes, we have remote patient monitoring, smart cards that they're looking at, electronic prescribing, and wireless mobility. The goal is to improve health conditions via the technological advances. The benefits must exceed the cost. That's the way that the medical community looks at return on investment improvements. The nature of technological changes benefits improve longevity and the quality of life for people, and help people be less time spent away from work being sick. They have ways of new technology that they use. They look at two methods: treatment substitution effect and the treatment expansion effect. One substitutes technology for old technology on their patients to improve the condition, and the treatment expansion effect allows more people to be treated for diseases. On the forecast for the healthcare industry in 2020, the team came up with a couple of important recommendations. One was global. we found a trend that the universal health care rights for those countries are being reversed. They're looking at going to what America had, individual managed accounts. So we recommend that those countries stay with the universal health care rights because of the poor not being able to afford health care. And to improve their focus for funding on the global fund, which is suffering. The global fund is not being funded as it was created to be. The national local scene, we were in support of the public option. I feel like it must be available to all people, and that we also felt like all Americans, be the middle class or upper middle class, should be taxed. And we also feel like the should be regulatory enforcement to reduce the medical administrative costs, because that is where cost is high in the medical field. Technology, preventative medicine, look at things like remote patient monitoring, smart cards would be implanted in Americans so that you can monitor these conditions and look to improve one's health without waiting till you have the heart attack. Look at the things to prevent you from having such diseases. And that's the recommendation for the group from a political, legal, and technological standpoint.